Is this? Okay.
Yes, it's
Perfect.
presenting mode. You got it, Kim.
Okay. Perfect.
Do you want to do this slide, Alice, since you're used to it?
Yes, sure. And so welcome everyone to our positive behavioral interventions in community settings, family and caregiver series. So if you have been to one of our series, you already know kind of the routine. So although you are muted, but you feel free to chat in, to chime in anytime. And also we would have time for conversation. And at that time, feel free to unmute yourself as well. We would love to see your smiley faces if you can keep your camera on, but we totally understand if you're not in the environment that you can. Also, if you wish to receive a completion certificate that you might be able to use for CEU purpose, and please make sure that you're logging on with your first name and last name, and also just put a message in the chat to let us know your name and maybe your email address again, just so that we know we don't miss you. So if you need to rename yourself, you can always just go to the participant name box and then click on the 3 dots and then right click and then you can choose to rename. Again, this series has been supported by the University of Kansas Pediatrics Department, but also Kansas Cabinet and Trust Fund, and all aim for Kansas Kids Quality Sub-Grant and a Cigna grant as well. A lot of support behind this series. Next.
Oh.
Yeah, so should someone take over? Or?
Yeah, I'll. This is hosted again by Integrated Behavioral Technologies with a fund from the state of Kansas under our PBS series. Today we have a presenter, Kim Riley from the Transition Academy. Sean and I met Kim a while ago. We were pretty excited about being able to meet her and subsequent meet with her to learn about what she's doing. She's really, like I said earlier, she's a dynamo in the field. We're going to let Sean do a little bit more of an introduction for her here in a minute. So next slide, Kim. The agenda for today is we're going to do this little introduction. Then Kim's going to present and tell us about all the wonderful work she's doing. I'm really excited about all the work she's doing, and she seems to have a nonstop supply of energy as she continues to go out and advocate for our underserved individuals with autism, as they, in a very underserved population, are transition age youth, really. And so following that, there's going to be a group discussion where we can do follow-ups, follow-up questions or suggestions. Also, feel free to put a question in the chat and we'll be monitoring the chat. You may or may not see on the right-hand side of your screen, it says level up. There may be something when you see that to put in the chat box about how you're using that particular concept in your current work with in the field. All right, next. All right, so one of the things we do, just like we do with any grant funding agency, is we have to demonstrate to our funders that we're actually doing what it is that we say we're going to do. So, and also to be able to improve our training. So when you get your feedback survey, please feel free to complete that. You'll get a survey link from us after the last session, so fill it out. Let us know any future topics you would like to do. Mitigating potential bias. So this is on behalf of Kim and IBT and Cigna and K Med Center, that the information that we're presenting here is based on evidence that's currently accepted within the profession as an evidence-based practice. So next slide. So Sean, I'd like you to do the honors now of introducing our illustrious speaker today. I'm really excited that Kim, you're presenting. So I'll turn it over to Sean, and then Kim, it's all yours.
Well, I'm Sean Swindler from the Kansas Center for Autism Research and Training, and I'm really honored to introduce Kim. I first met Kim in pre-COVID times, where we had a group planning for a potential third autism summit in Kansas City. And she was a part of that group and was really instrumental in helping to steer the conversation to more significant topics, to more revolutionary topics, that we're not going to stand with the status quo. We're going to really want to make some real change. And that's kind of what Kim has done. Kim is a social entrepreneur based in Kansas City, Missouri, and she's worked extensively in higher education, health, and nonprofits. And in 2019, she founded the Transition Academy as a solution to the confusing and poorly designed post-secondary preparation process for students with disabilities, a problem that directly impacted her son and impacts every child in transition with a disability, especially autism or more complex disabilities, runs into this poorly designed transition system. Kim has a Bachelor of Journalism Degree from the University of Missouri and an Executive MBA from UMKC, and 20 years of experience in disability circles, including co-founder of KC Walks for Autism Awareness, as well as a member of the Mayor's Committee for People with Disabilities and Kansas City's Autism Speaks Executive Leadership Council. Kim is committed to collaborating with multiple stakeholders across sectors to build a sustainable system that ensures all students, regardless of race, ethnicity, or ability, are equipped to become contributing members of society. And she'll be presenting on transition-aged youth and supporting health during transitions. And she's going to speak about how to help transitions and the preventive strategies with skills to teach. So it's my honor to introduce Kim Riley.
Oh, thank you so much, Sean. Sean is one of my favorite people on the planet. He probably has no idea, but he is such a great resource. And when you are trying to make changes, sometimes people who are status quo will try to convince you that something is wrong with you. And Sean is one of those people who assures me that there's absolutely nothing wrong with me and to keep pushing. And so I thank you so much, my brother, for that warm welcome. Linda has also been an amazing resource to talk through real systems change and really getting to the root of some issues to really move our movement forward. I'm excited to be here today, and I wanted to just talk really broadly, but then at the same time at a kind of micro level about some of the initiatives that we're taking on to really explore disability transition from a racial lens. And so our objectives are pretty clear, that we want participants to really understand the role of race and how it impacts ability. And also, we want to also just kind of examine how the Transition Academy and KC Public Schools partnerships, how it applies the three-tiered approach to transition outcomes for students with IEPs. And then finally, we want participants to leave with an understanding of the social justice framework for mobilizing the community to really understand transition disparities and to move forward with us to change the system. We've tried for years, we've talked about it, and now within our insulated circles, and now we want to move forward community-wide. Okay, and then do you all discuss the PBS model tiers?
Yeah, so PBS, for those of you who are not familiar with, it's a system of intervention delivery that looks at trying to provide primary prevention, like in schools, classrooms, across all students, regardless of ability, disability, whatever. And the more we can get supports in at that primary or primary level or tier 1 level, the less likely it is that we're going to have kids that need secondary prevention or specialized groups, right? And the more that we can support those kids, the less likely we are going to have those kids that need tertiary or specialized or individuals or that they become students that are really, really high risk. So the PBS framework, looking at the work that Kim does, is what she's trying to do is change the system. She's trying to change things at that primary level so that all students, regardless of ability or disability or diagnosis or whatever, has access to services throughout the community to try to prevent them from coming in contact with juvenile justice, or and try to prevent them from becoming in that top tier where they're incarcerated, like the young man you were telling us about. I guess he's not a young man anymore, but that's in a maximum security prison, right, for a non-violent crime. So anyway, that's the PBS framework, is like looking to see how we can provide more of those supports at that primary level.
Okay, so it's so interesting. We launched, officially organized in 2019, and we were all set to launch in 2020. We had all these in-person activities, and we were going to change the world, and then COVID hit. And like everyone else, we were forced to go virtual. And so it started pretty simple. As my son graduated in 2019, and so my heart really went out to parents who were going to have to homeschool their children overnight with no guidance, no warning. They were going to have to become therapists, teachers, paras, cafeteria workers, and so I was looking at it from the parental lens, and then I was also realizing my friends who were teachers, therapists, and all of us in disability serving spaces, we were all kind of deer in the headlights. And so I hosted a kind of a come one, come all session, and we decided to have weekly convenings called Tuesday Talks. And it was to keep all of us connected to ride out the pandemic. And this was when we thought the pandemic, that it started in March and we were going to be done with stay at home in May. Remember those glory days? And so we were fortunate. We had lots of live viewers, as well as those who went back and watched it afterwards. We were able to forward more than 40 resources from the state level, national level, and local level to families, schools, and stakeholders. And we were moving along, having such topics as how to deal with challenging behaviors at home, how to have a talk with your child about sexuality, and hearing and having a lot of information exchanges from healthcare, from schools and families. And then all of a sudden, the George Floyd protests hit. And at that point, those of us who are Black, we were feeling really a range of strong emotions. We felt that our disability partners, many of them, they turned their backs on us. The Autism Society of America, for example, they issued a statement of human rights in which they said, "We stand in solidarity with peaceful protesters." And it was like, really? That's all you want to do? Here we are, you 8 minutes and 46 seconds, the whole world watched this man killed viciously while, the rest of these officers, stood back and forbade anyone from intervening. And all you want to do is stand in solidarity with peaceful protesters. And then some of the comments on the post were, "Oh, everyone wants to always make everything about race. We're all bullied." And so there was a tone deafness from the autism community. And so I took all of my frustrations, my fears and hopes for my child, and knowing that they resonated with other families, and we hosted a webinar called Out of the Shadows, Black Families with Autism Speak Out. And we had attendees from all over the country: Massachusetts, Florida, Texas, North Carolina, Chicago, DC area. And there were Black families who found out about us, and they just wanted to connect. And we talked about what it's like to raise Black sons in who have disabilities that play out with behaviors in these times. It's never been a good time to raise a Black son. It's always been a scary time, but it's really heightened when you couple that with a disability. And we